Hey, everybody. Welcome this evening to a special broadcast with myself, your host, Coach JJ, and our featured healthcare provider, Dr. Dawn Figlo, who is a board certified podiatrist and foot surgeon with well over 20 years of experience in caring for all things feet related and especially taking care of people that have diabetes. And we wanted to come on this evening to do a broadcast about Diabetes Awareness Month. And as we all know, when you're a diabetic, you are at an increased risk for issues with your feet. So Dr. Dawn and I wanted to get together and talk to you guys this evening all about feet and all about the things that you should be mindful of and things that you need to consider. And so let's get started. Dr. Dawn, tell us about yourself. What's your background?
Hey, JJ. Well, you did such a nice job introducing me. So thank you. Yes, I've been a podiatrist and foot surgeon for 20 plus years. I've had the honor of treating many, many people with diabetes. So it's very close to my heart because I, have a real emotional attachment to my patients. So I'm so happy to be here because I think there just needs to be so much more awareness, even when it comes to the feet, especially right with people with diabetes. So I'm excited about that. I am founder of the Organic Foot, so I do like to use natural medicine when it's appropriate. So yeah, so there's many times we can turn to nature first, and that's what I like to do. But anyway, I'm just thrilled to be here and have a conversation about diabetes and the foot.
Well, we are definitely thrilled to have you, and we appreciate you spending time with us this evening. I wanted to lead into this conversation with a story that I have with a patient of mine who unfortunately is not here anymore. He passed on January 31st of 2014. I unfortunately was his power of attorney, and I was the person that had to make the decision to cut off the life support stuff because I knew that he wasn't going to recover and that he did not want to be stuck. But what led up to that is he was diagnosed as a type 2 diabetic, probably had diabetes for a long time, but you couldn't tell exactly by looking at him because he didn't fit the typical profile of a diabetic. He wasn't overweight, although he did smoke like 2 packs a day. So he smoked a lot. He didn't drink, but he had a craving for sweets and sweet tea and all that kind of stuff. And he was below the poverty line in terms of finances. And um, you know, after working with him for a while, we found that he had some ulcerations on his feet. He went to a primary care provider and they just, slapped on, this little antibiotic here and this little cream there and so on, and never really spent time educating him. And he would walk around barefoot and walking around like in his yard where there's, animal feces and things like that, not paying any attention to his feet. And the ulcerations got worse and worse and worse. And it ended up to where he got a severe infection in the bones of his feet and had to have 2 partial amputations. And then it got to where the foot basically was going to have to come off. And 2 weeks before we were scheduled to go in for the consult for the surgery, we had already had one consult that I brought him to. 2 weeks before, he ended up dying. And I think that perhaps the infection in the foot contributed to his condition and all that. And I never want to see that happen to anybody else. And I'm sure that you probably feel the same in terms of the number of patients that you've attended to over the course of your career. So if you could share a little bit about that, that would be great.
Yeah, yeah. It breaks my heart when I hear these stories, and I have been a provider that was a part of taking care of people that had similar stories, right? And I still am. So it just highlights the severity right? That so diabetes can be a deadly disease, right? We know that. We hear that, right? We hear these terrible stories.
Yeah.
The good news, it can be a very benign disease as well. And
Yeah.
that is so important to understand. So tapping into your support systems, educating yourself, believing in yourself, believing that you can get well. Okay. And I'm really focusing more on type 2 now, right? But believing that, and using all the tools that people like JJ can help provide for you, um, you can live almost a disease-free life. So it's super important to know that yes, it can be a deadly disease, but yes, it can also be a benign disease. So that's something you need to hold on to. And because I also treat many diabetics that take their disease extremely seriously, and again, change made changes in their lifestyle and so on and so forth. So anyway, they have hardly any manifestations of the disease. So
Well,
when it comes to the foot is a window in. It's a window in to
yeah.
see what is going on with the rest of the body. Okay? When a podiatrist, and this is why I'm gonna I'm gonna answer a question that you didn't ask, JJ.
That's okay.
Why see a podiatrist, right? Why see a foot surgeon, podiatrist, foot specialist? And the reason is that we check things that you cannot, if you look at down at your feet, you wouldn't be able to detect. Okay, so when we have your feet in our hands, and sometimes I say this aloud, I always try to because I want my patients to understand what I'm doing. But the first thing I do when I hold feet is I check the pulses. There are two main arteries in the foot. So I find both main arteries, the dorsalis pedis and the posterior tibial, and I make sure they're palpable, that I can feel them.
That's how you
Okay.
check circulation, right?
Yeah. So I'm checking circulation, right? And I'm making sure I can feel these arteries. If I can't feel them, I might whip out a little Doppler. Sometimes they're not palpable, but when they're nice and strong, they're palpable and I can feel them with my fingertips. All right.
Mhm.
And that's what we really want. But sometimes I need a Doppler to assist me.
Right.
If if I'm still having concerns after I do that, then I will refer the patient to see a vascular surgeon. Okay.
Mm.
So the small vessels in the toes and in the foot, the small vessels get compromised when blood sugar is too high. Okay. So what we get is this spasming of the small vessels. And it can lead, obviously, we just heard a story, right? It can lead to delayed healing is a biggie. Okay. So that scrape that the ordinary person got will heal in, say, 4 or 5 days. Well, when you don't have the blood flow, that's what heals cuts and wounds, the blood, right? It's bringing all the different cells needed to repair that area. And when you don't have the blood flow, you can't repair quickly. So circulation is one thing that's critical for us to check. All right.
Mm.
Number two would be the neurologic system. So we want to see if there's impairment neurologically,
Right.
because you know that you can have diabetic neuropathy.
Yeah.
Again, from the blood sugar being too high, it turns into something called sorbitol, which is very destructive to nerves.
Mm. Ooh, I'm sure we could probably do a whole discussion about that.
Yeah, of course. This is good stuff. So with that, yeah, so then sometimes people don't know that they're neuropathic. And why is that important? Because if you have neuropathy, you really want to be extra protective to the foot. Okay. And because that little scrape, right? So, I call it the trifecta. I think I probably mentioned this on our last discussion, JJ, but the third system that we are worried about, right, is the immune system.
Right.
So when the foot gets injured, if people have decreased circulation, decreased sensation, and decreased immune response, that's why these infections progress so quickly. And then lead to gangrene and
And I imagine that so the vascular system is there to provide oxygenation and nutrients to the tissue, and then the neurological system is there to alert us if there's a problem. So then we have this combination of things. It's like, wait, okay, so we don't have oxygenation and nutrients to the area. The body signals that tell us we have pain aren't there, and then with the decrease in circulation, the white blood cells can't get there to do their job to actually repair when we have an injury. It makes me think of my husband, and I want to smack him right now, because just the other day, he's the type 2 diabetic, and lately he's had a little bit of trouble controlling the blood sugar, and he's standing outside barefoot, trying to saw wood barefoot. Like, he put the wood on the table, on a glass table, and it's 50 degrees outside, and he's barefoot, no shirt on, and just like, he's just lumberjack husband guy. And I'm like, are you crazy? What are you doing? And he's like, I'm fine, I'm tough. And I'm like, you think you're tough because you can't feel stuff because you're diabetic. So it's really important for us to take really good care of our feet and make sure that we're protecting them. So I'd like to move along into the practical things that we can do on our own to help us care for our feet better.
Sure. So I would say things that you don't want to ignore. Okay. Toenail fungus is one. All right. So, but when we think of fungal infections on the foot, toenail fungus, athlete's foot infection, where you get some redness. Sometimes you have little vesicles, clear vesicles, and scaling. And a big one is in between the toes, when you get that white and peeling in between the toes. So, and the reason being is, all of these things are just much more serious when you have diabetes. Okay.
Right.
So so pampering your feet a little more, getting, whether you're using natural care, okay, or prescription care, but addressing when you have what you think might just be an athlete's foot infection. Don't ignore it. And the reason why I'm telling you this is because these fungal infections are extremely common on the foot. Fungus loves moisture. It loves darkness. A shoe is the best place for it to live. And even when you're caring for the foot, by the way, make sure you treat the shoe, because those fungal hyphae, they're microscopic. You cannot see them. And now you put your foot back in the same shoe.
They live in there, right?
And you're getting reinfected. So make sure, I always say, not only are you treating the foot, but you're treating the shoe. All right. Or get yourself new shoes while you're doing this.
Awesome.
But the reason why I'm telling you this is because when the skin breaks down, right, you're scratching it, or especially in between the toes, when we see that scaling and that, we call it maceration, when we see that white boggy in between the toes. When we see, right, those, a lot of times, cellulitis, which is a bacterial infection, right, of soft tissue that we see sometimes climb up the foot and up the leg, and it can be very, very serious. But that all starts because the skin broke down because of a fungal infection.
Man, I can't tell you how many patients that I have, worked with in the hospital setting that were in there for cellulitis, and it was like all the way up to the kneecap. And I'm like, how did this even happen?
And
Now I know.
yeah, and sometimes patients will say, well, I don't have a cut. I don't have a wound. I don't know how I got cellulitis. And I look in between the toes and I'm like, ooh,
And there it is.
So that's a big thing. All right. I do like iodine, betadine. If you have that maceration, just a little cotton ball to dry it out and take care of that.
And you can get that at the over the counter at the pharmacy, right?
That's right. As far as natural antifungals go with essential oils, tea tree would be your number one essential oil for that. And when you're using pure oils, don't forget you want to dilute with like a carrier oil, like fractionated coconut oil. And if you're using pure, which you only should be using because that's where you get the therapeutic benefits, 1 to 2 drops. That's all you need. Okay. Very, very, very powerful. All right. So those are just some things that I don't want you to neglect. And when it comes to toenails, right? How many times have I been asked, how do you cut your toenails, right? So
and we've seen this a bunch in the group. There's been a bunch of questions about, ingrown toenails and how to clip the toenails and should I do it myself? And I've seen a variety of different comments of, oh, well, soak your feet first and then clip them, or definitely don't touch them, go to a podiatrist. So as a podiatrist, what's your thoughts on that?
Okay. So okay. And by the way, we have toenails that resemble nice, healthy nails. Okay. And then we have toenails that don't resemble toenails.
Yeah.
That are this thick. And,
right.
you need I don't even know, a gardening tool to cut them. So with that said, though, that's important because if somebody, what I find is when the diabetic patient tries to cut those really difficult nails, oftentimes they'll nip themselves or they'll go into the corner and whatever. And that little cut can, lead to something horrific. So that's why I say, I don't want to, if you're a diabetic and you have access to a podiatrist, please see a podiatrist. But if you have nice, healthy nails and you're keeping, your diabetes in control and, you don't have a lot of secondary issues, make sure you're not cutting down on the sides, right? You want to cut straight across. The minute you go into the sides, that's when trouble starts. All right. But really, if you have the option to go to a podiatrist, go to the podiatrist.
Thank you for bringing that up. And that brings me in mind of 2 additional questions that I had for you. The first one being that now we're approaching winter season, and so we have like dry air and like lower humidity, and I've seen a lot of people talking about, oh my god, my feet are so dry, like I have like calluses and just like this dry, flaky skin, which not necessarily indicative of a specific condition. It's just, the change of season. So what would you recommend for people to be able to help themselves out with that?
Yeah. So again, I really personally try to direct my patients in a more natural way of taking care of themselves. And
amen.
One of the reasons at the foot why that's so important is because you have over 250,000 sweat glands per sole. So we have a lot of absorption at the foot, right? Our socks get soaking wet sometimes when we're sweating, right? We know that. So what does that mean? That means when we're using toxic products, okay, and a lot of lotions and creams are full of parabens and phthalates and sulfonylural sulfate and, all these, even petroleum, all these carcinogens, all these dangerous chemicals. And now we're applying them to the part of the body where
you're going to absorb them, right?
So, you have enough to worry about. Don't add. So I say find your natural foot products. You can make them. There's plenty of natural recipes with coconut oil and jojoba oil, and and add a few essential oils. Lavender is wonderful for the skin. So find those. And by the way, when you cover, like, so if you do get those really thick heels, you can soak your feet. By the way, people ask me about Epsom salt all the time. Is it safe for diabetics? Da, da, da. So the rumor out there has been, don't soak your feet in Epsom salt. Well, I have seen miraculous things with Epsom salt. Okay. So it's hard for me not to say, don't soak your feet with Epsom salt. I have tried to find studies that showed a negative reaction to people with diabetes and Epsom salt soaks, and I have yet to find one.
So I have yet to find one either. I've looked. There aren't any. And I'll just go so far as to say that, the primary, molecular active thing in Epsom salt is magnesium sulfate, right? And guess what, people? We give magnesium sulfate to pregnant ladies in the hospital when they're having high blood pressure and a condition called preeclampsia, because we can't give them other medications. So we give them magnesium to help them. So if it's safe for a pregnant lady, IV, it's safe for your feet.
And we ingest it when we're constipated.
Yes. So it's what they give you for colonoscopy.
Right. So anyway, I'm just a lot of my care has, been with Epsom salt soaks in the past. So I have not seen any adverse reactions, with Epsom salt in general and with people with diabetes. Now, with that said, okay, if you try something new and you see an adverse reaction, all of a sudden you see, your foot has hives or your whatever, do not do it again. You're having a reaction, and that is, listen to yourself, listen to your body. You know best about you. So I will go back to the really thick heels. Okay. So soak them, whether you choose Epsom salt or not. You can put a few drops of, essential oils in if you'd like as well. And then I always recommend nothing sharp. So I would just get a pumice stone. And that's how that's what you would use to get some of that dead skin off. Okay.
And you can find those cheap at like Walmart, Walgreens, CVS type deal, right?
Yep. Yes, you can. And if you do have those deep, deep fissures, though, those deep cracks, because when the callus builds up very thick, it starts to crack. And when you get those cracks, they're very painful. Okay. And I can tell you, in one visit, a podiatrist can debride that down to something that it's, you're not causing a wound, nothing. You're just taking the callus off and you'll feel so much more comfortable. So that is something that, go in to see a podiatrist if you have that thick and the cracks. Tea tree oil is really good for those fissures, by the way. Okay. So tea tree is good for that. Yeah. So that's something, picture yourself. When you soak your feet, do you know how good you feel? It's a wonderful feeling. So it's a little self-care,
You're convincing me to do that this evening, I gotta tell you. So I think we've covered a lot so far this evening, and I think we've given a lot of people or a lot of things for people to think about. So final question is, how do you get to a podiatrist? Do you have to ask your primary care? Do you have to ask insurance? Do you just call one? How does that work?
Yeah, very good question. It really depends on your insurance. So if you do not need referrals to go to specialists, then you don't. Then you can call directly a podiatrist. Okay. If you know that typically you need referrals, or if on the back of your card it says that you need a referral, then go to your primary care physician or your endocrinologist and tell them you want to see a podiatrist. And just a little shout out for podiatrists. So sometimes I get the question, right? Sometimes I get the question, well, why a podiatrist? Like, how, and I just, I do not feel that there is a lot of education out there about our education. So to be a podiatrist, you become a doctor of podiatric medicine, and it's 4 years postgraduate, okay, on top of your graduate, your undergraduate degree. And then it's a 3-year surgical program. So, and this is all focused on the foot. So you have, real specialists that you can tap into for all of your foot problems. But, I think also, JJ, the main message I have is to listen to your own body. Okay, because your body tells you everything you need to know. Listen to it, get in touch with it. If you can, start to get silent with yourself. Find a place, quiet place. Breathe in, breathe, get connected with your body. Get connected to your breath, get connected to your body. Know that you have the power. Don't relinquish your power to systems. And I spoke to JJ about this before. Don't relinquish your power to anyone else about your body. You are in control. You are in control of your destiny.
Amen.
Believe in yourself and believe in your well-being. It's in your grasp 1,000%.
And it starts with us, right? It starts with us having that awareness to where we can say, hey, this isn't right. Let me do a little research. Oh, wait, I should talk to an expert. I should talk to a provider to help us get the help that we need so that we can be healthy. And I kind of feel like it kind of, they say, what is it? Head, shoulders, knees, and toes. I think it kind of maybe starts with the toes, because it's like that's how we're grounded, right? That's how we're grounded on the earth everywhere we walk and throughout our day. And I love that message. On that note, I'm going to say thank you so much for spending your time with us this evening, Dr. Dawn. And if anybody has questions, comments, or anything, how can they find you?
They can go to my website, which is theorganicfoot.com. I'm also in Manhattan, in the Shannon building in Grand Central. So if they would like to see me there, they can. I was looking for my phone number there. Do you know I don't even have my card handy? Oh, wait, here, wait. Wait, I can actually read you my phone number there. It's 212-697-3293.
Awesome.
Yeah, so give a call, reach out on my website. You can leave a message if you want to just ask me a question. And, I love this group. However I can help and serve you, it's my honor and pleasure.
We are absolutely blessed to have you with us, to help us out and to help us answer questions and give support. But most importantly, you bringing your light and goodness to us and helping encourage people along the way. So thank you so much for helping us do this podcast this evening in honor of National Diabetes Awareness Month. And for folks who are watching that might have a friend or family member that you think might have diabetes, talk to them, start a conversation. You can direct them to our group. It's the Type 2 Diabetes Support Group on Facebook. We'll have links posted below this video. If anybody's interested in health and wellness coaching, I'll post a link for that as well, where you can reach me as far as that goes. And we will be doing future podcasts with Dr. Dawn. We have lots of things that we can dive into, including the impact of essential oils and just more in depth about foot care and all those wonderful things. Any final thoughts, Dr. Dawn?
Well, I just want to thank you, JJ.
Oh,
because you shine, and your service to this group and to others really is so beautiful. So thank you for being here.
Thank you, and you're welcome. It is my pleasure, my honor, and my duty to be of service to everybody that I can. In the words of my favorite psychologist, Dr. Jordan Peterson, may I live well enough to justify the terrible privilege of my existence. All right, folks, thanks for joining, and we'll see you next time. Coach JJ out.
Dr. Dawn.